to Ignite Success. I'm Snowden McFall, your host, 25-year professional speaker, 6-time author, and women's coach. And with me today is Anne-Marie Knight. Anne-Marie is the Chief Diversity Officer and the Vice President of Community Engagement at UF Health. Welcome, Anne-Marie.
Thank you.
Did I get all that right?
You did. Thank you. Thank you.
You're welcome. So I know this is the 150th anniversary for UF Health.
Yes, it's an exciting year.
It is. So tell us about that and how is it going to be celebrated?
So multiple ways. We think about the audiences we have, right? Our patients, of course, are primary, our fellow colleagues and health leaders, and of course, the community at large. So we're going to do some things for our staff. And treat them as though they were there for the 150 years.
That's right.
And engage with our patients. And then, of course, the broader community to make sure and remind our community that we were the first. We were the first in the city. We were the first non-military hospital in the state of Florida.
Oh, I did not know that.
Yeah.
Wow,
so
that's terrific.
We're just going to, relive that a little bit by sharing some of the history and having some outreach activities.
Which is wonderful. And I know I had the privilege of sitting next to your fearless leader at the longest table for the Jacksonville Chamber, and that was wonderful. And I know he's a progressive and visionary leader. So
absolutely.
That's wonderful.
Yeah.
And you are being honored as a woman with heart for Volunteers in Medicine. Tell us about that.
I am. So Volunteers in Medicine established this award recognition some years ago to recognize women in the community that are doing good work, whether it's directly because of their jobs or through their own personal commitments to the community. So I'm honored to be selected as one of those women this week.
That's terrific. And so when is the event?
The event is Thursday. It's a lunchtime engagement, and it truly is. It's not just about it's not about us.
Right.
It is a way to elevate awareness around Volunteers in Medicine and the good work they do to help those who don't have health insurance. So it is really it's a fundraiser. It's an opportunity for awareness and to generate some funds towards their mission.
Yes, we've had Jennifer Ryan on, and I know Volunteers in Medicine provides health care for the working uninsured.
That's exactly right.
So and so these folks are working, but they just are not insured.
Absolutely.
Yes,
absolutely.
that's wonderful.
And all the care is provided for free. So it has to be funded somehow.
That's right. That's right. So this luncheon will honor 12 women. Is it 12 women?
I believe it's 12 women.
12 women who are doing great things. And each of you will do something to support the organization throughout the year.
That's exactly right.
And most interesting, I know that now you're doing some work with the Urban Core of Jacksonville.
Right.
Can you share about that? Because it's such important work.
Right. So there's two things. And, life comes together in its own design, not by our design, right? So at UF Health, one of the draws for me was the work around what we're calling the Urban Health Alliance.
Okay.
And it's truly that as a healthcare institution, we recognize we take care of the health need and the chronic disease and so forth, but we need to stick back a little bit in the life cycle and really look at how we can impact positively the social determinants of health. So how can a hospital contribute to the wellness around job security, education, housing? It's not our lane. Right. But the exciting part about it, we have so many great colleagues in this community and organizations that there's an opportunity, we believe, particularly around our patients, to engage with these agencies a little bit more intentionally.
So I know that when we were in Leadership Jacksonville, we looked at how the Urban Core is so impacted in terms of lack of access to fresh produce. Right. And yet there's the highest rate of diabetes, highest rate of coronary disease, different things like that.
That's right.
So how will this initiative address that? I understand you have an RV and there's all sorts of programs.
So there's in our electronic medical record, we have the ability to ask a patient, what are your insecurities around social determinants of health? So now we can capture data around you. May I use you as an example?
So, sure, but what does that mean? Because I don't know. Some people might not know what an insecurity is.
So it may simply maybe a conversation around the fact that you don't have a job.
Right. Okay. Got it. Mm-hmm.
And so in that conversation that comes up, and we will refer you through our electronic medical record, through resources. What's great about that is now we'll be able to kind of keep track of you.
Okay, great. So if you wanted to use me as an example, go ahead.
Right. So you now come back 6 months from now for an appointment. We want to understand that referral we made. What did you do?
Okay.
And did you get a job? And, what things are happening in your life? While that's getting resolved, which is for the greater good of the community, our ultimate goal is to see your diabetes improve.
Right. Prevention.
The prevention,
Right.
right? Because we can't simply treat the disease.
Right.
That's not working.
Right.
We have
Obviously.
evidence
Yes.
there. But so now, can we get a little bit more intimate around the social determinants? The environment that you live in. Do you have safe sidewalks? Do you have lighting? Can you go for a walk and feel comfortable like others in our community?
Can you leave the community at night?
Absolutely.
Right.
So if we can help raise awareness around these factors a bit more, then maybe we as a community can recognize the conundrum we're in and that we need to address it. But for you individually, we'll monitor you. But in the aggregate, we're going to have rich data to really share with the broader community to say, okay, we got to do something.
So this is going to the city council in February, March?
So this is not quite the same thing.
Okay.
So what you're referring to is my role as a commissioner for the Charter Revision Commission.
Okay.
So it was something that I was invited to be involved in prior to coming to UF Health, but the synergy's there.
Right.
And so I'm chairing the Urban Services District Subcommittee, similar work. The genesis of it is around our consolidation 50 plus years ago, and the idea that some areas of our community were not, the promises weren't kept.
Right.
Unfulfilled promises of consolidation. And so now let's fast forward to today, putting the promise aside in my mind, what do we have that's going on? Where are the disparities in our community around our infrastructure and health and wellness access for our citizens? So there is some synergy between the two work.
Right.
But our commission, our job is to provide a proposal to City Council on what do we recommend.
Great.
It's a huge problem, and we realize the complexity of it, but what can we recommend to the City Council that they can consider to help remedy? It is not a 1, 3, 5 year solution. It is a multi-decade, but we got to start somewhere.
Yes, we do.
Yeah.
Well, thank you for everything you do for our community, Anne-Marie.
pleasure.
You're an extraordinary woman and a great role model, and we appreciate all of your work.
Thank you.
Thank you.